Hi there, my name is Dr. Douglas Schottenstein. I am a practicing interventional pain management physician in New York City. And one of the most common conditions that I see in my practice is back pain. Back pain is very complicated, frequently multifactorial, and it affects millions of people worldwide. It's also probably the second most common medical condition in the United States, probably secondary only to headache. Frequently, because of how complicated it is, a multimodal approach, including medication and intervention, is often employed to achieve lasting remission. While medications such as anti-inflammatories and opioids can give global, meaningful benefit, interventions are less global, more targeted, and more focused on specific pain generators. The prevalence of lumbar or cervical facet joint disease associated with back pain is unknown. But the facet joint is a true synovium-lined joint, allowing the spine to flex, extend, and rotate. And many conditions exist that produce facet disease, the major cause of which is osteoarthritis, which is the degenerative condition that results in reduction or loss of the facet joint cartilage. This can cause the sensory nerve endings innervating the facets and the surrounding tissues to become irritated or inflamed, and because of that inflammatory process, a patient may, in fact, feel pain. Imaging and physical exam are notoriously unreliable for the diagnosis of facet pain, but once the diagnosis is even entertained, a diagnostic low-volume intra-articular facet joint injection or a block of the nerves that innervate the joints, called medial branch blocks, can be performed. These intra-articular and/or medial branch blocks, when successful, limit or even completely resolve facet-mediated back pain, but their durability may be limited. So more prolonged destruction of facet-mediated pain is often sought. Radiofrequency denervation has been shown to be effective in the treatment of facet pain, especially in patients who have an excellent response to these aforementioned facet injections or medial branch blocks. The radiofrequency technique is well suited to facet denervation, mostly because the lesion size, the temperature, it can all be well controlled. The lesioning does not impair the basic architecture of the nerve. The axon is largely intact post-procedure. But the denervation is long-lasting, and nerve regeneration, while typical, takes a long time, typically 1 to 3 years. So with proper technique, the patient may have a significant pain relief for 1 to 3 years, and this, again, may be reproducible. The procedure itself is not complicated. It's rather basic, rather quick. In the lumbar and thoracic spine, for example, the medial branch of the dorsal ramus courses over the base of the transverse process at the junction of the superior articulating process. And each facet joint has dual nerve supply. For example, the L4-5 facet joint has nerve connections with the medial branch nerves that courses over the base of the transverse process of L4 and L5. And names of these nerves would be L3 and L4 medial branch nerves. So during denervation, the patient is placed prone on the fluoroscopy table, as he or she would be for any intervention, spinal intervention, and the low back is prepared in a typical sterile fashion. Once the medial branches are approached using the traditional needle manipulation techniques, sensory motor testing is performed, and once proper position is assured, a radiofrequency generator delivers probably 70 to 80 seconds of lesioning at typically 70 to 80 degrees Celsius. And post-procedure, patients typically feel slow onset of benefit, and the maximum effect usually occurs probably 1 to 4 weeks post-procedure. As I mentioned previously, the benefit is typically durable. The benefit typically is 1 to 3 years in duration. And although patients will not be cured of their pain, the dramatic response is, again, reproducible. So within the model of multimodal management of back pain, radiofrequency ablation is just another advanced tool useful in hopefully making a dramatic impact. Thank you very much.